Hi, everyone. My name is Shalavedya. I am a physician with a background in family medicine, emergency medicine, and public health, and I'm a yoga therapist. So I'm here to talk to you today on Healing Our Heroes, Yoga Therapy for the Frontline, and this is for Global Yoga Therapy Day 2020. So just to start, we always start with our disclosures. I've never received any money from Big Pharma. I currently don't have any grants. I have done some speaking. I do some speaking for fees. I also want to acknowledge that I'm presenting to you here from Toronto, Canada. And Takaronto for thousands of years has been the traditional lands of the Huron-Wendat, the Seneca, and most recently the Mississauga of the Credit River. Today, this meeting place is still home to many Indigenous people from across Turtle Island, and I'm grateful to have the opportunity to live and work on this land. So for our talk today, we have a few objectives. The first one is to review current research on the effects of the COVID pandemic on frontline workers, and I promise I won't make it boring. To understand the factors affecting the health and well-being of our frontline during this pandemic, and to review therapeutic yoga techniques that have been shown to help with identified factors, especially the practice of compassion. I always like to start with a practice. So I'm going to invite you all to stand up, and I'm going to do the same. I'm just going to unplug here for a second. You can hear me. So I'll invite you to stand up. Come into a comfortable position. I'm going to ring my bell. With the sound of the bell, I'm going to invite you to inhale in, roll the shoulders up. And as you exhale, roll your shoulders back and down, sliding them down, sinking into your feet. Again, inhale, roll the shoulders up. Exhale, slide them back, dropping into the feet. Again, inhaling in, a nourishing breath for you. And as you exhale and roll the shoulders back, release, let go of all that's not yours to carry. With your next inhalation, you're going to inhale and breathe all the way down to your right foot, feeling the sole of the right foot on the ground, feeling the heel, the side of the foot, the ball of the foot and the pads of the toes, feeling the spaces in between. Inhaling into the right foot, grounding. Exhaling, rooting, feeling yourself heavy on that right foot. And then with your next inhalation, you're going to breathe all the way in and down to your left foot. Feeling the heel, the side of the foot, the ball of the foot, and the pads of the toes. Sensing the spaces in between. Inhaling into the sole of the left foot, rooting here. Exhaling, grounding. And then with your next inhalation, breathing in, nourishing breaths. Exhaling and grounding into both feet, feeling the soles of both feet on the ground. Move your weight forward and back, feeling yourself anchored here, side to side. Allowing each inhale to draw in nourishment into your body. And each exhale to release and let go of all that's not yours to carry. Surrender it up. Not me, it's not mine. With your next inhalation, I'm going to invite you to inhale and turn your palms open, breathing into your heart. As you exhale, you're going to lift your hands up, sitting back into chair pose. Inhale, press into your feet, reach up to the sky. Exhale, lower your arms down. Bring your hands to the heart, connect with yourself. Inhaling into the heart, something good, something you need. Exhale, raise the arms open, reaching up. Inhale here. And exhale, bring your hands back to your heart. Again, connecting with yourself. Just taking a few moments to breathe in and out here, drawing in what you need. And releasing all that doesn't serve you. Releasing it up, surrendering. It's not me, it's not mine. And maybe thinking of a person that you're caring for, or that you're concerned about. Saying these words to yourself. Everyone is on his or her life journey. I am not the cause of this person's suffering, though I may try to help as best as I can. Watching the suffering is difficult to bear. May I know I am doing the best that I can. Breathing in and out for yourself. Inhaling in the nourishment. Exhaling out compassion for the person for whom you are caring. Remembering to draw in, for if we do not have, we cannot give. And then releasing the practice and shaking it out. And then joining me back here. I'm going to put my earplugs back in, just so the sound is a little bit better. Okay, so after that practice, I always like to start my talks off by asking these 3 questions. Maybe we're going to come back to them after, but the first question I'd like you to ask yourself is, how do you wish to be treated? Just think about that for a second. And then the next question is, how do you treat others? Take a mental note of how you treat others. And then ask yourself, how do you treat yourself? What's the voice inside your head saying to you? Do you notice it? Notice its tone and what it says. And we're going to come back to these 3 questions as we move on in the presentation. So as I mentioned, this talk is called Healing Our Heroes, Yoga Therapy for the Frontline. In particular, I'm going to be focusing on our healthcare professionals, but I want to acknowledge all the other people on our front line who are working so hard to keep society moving, and who may not be getting the credit, but and many of whom who are not getting the personal protective equipment to keep them safe either. And that is our transit workers, our delivery people, our grocery store clerks, everyone who's really working to keep us safe and fed. And I hope we can fight and make sure that we can protect them and get them personal protective equipment as well. And we'll go on to talk about our frontline healthcare workers in this talk. So I know many of you are concerned, which is why you're here. We know that the COVID pandemic has brought on an incredible amount of stress to our frontline workers and to our hospital systems. And many of us who are privileged to not work on the front line really want to help. So how can we help? The best thing is to always ask the people who are on the front line, what is it they need? And that's exactly what Dr. Tate Shanafelt did. He's a researcher, he's a physician and he's a researcher who focuses a lot on physician health and healthcare provider well-being. And he did some focus groups earlier on in the COVID pandemic as we were awaiting the tsunami. And what he found out were that they had these 5 wishes. One was hear me, protect me, prepare me, support me, care for me. And I'm adding another one here, honor me, which was what some commentator to this paper wrote. And I think we're doing a good job of honoring our frontline workers. A lot of people are out there at 7 o'clock at night banging pots and pans still to show support. And we saw that all around the world. So that's great. Hear me and protect me. And prepare me. were really at the source of the anxiety at the beginning of this pandemic, because we really didn't know anything about COVID-19 other than how contagious it was and the mortality rates we were seeing from it. So there was a lot of anxiety around that. We saw frontline workers cutting pop bottles to form face shields. We were running out of personal protective equipment, and we really didn't know much about the virus to prepare everybody to fight it. So we really had to, so it was very distressing for our frontline at the beginning, and for all of us, I'm sure. So mental health outcomes, this came from an Italian paper that was published recently, and it was looking at some cross-sectional studies done mostly out of China, as they had the pandemic first. So a lot of the research that has come out of there. What they've noticed was that depression was high among the mental health outcomes for the front line. Anxiety equally high, 23 to 45%. Insomnia was another significant thing that came up. About 34% of people reported that. And stress was anywhere from 27 to 70% of healthcare providers were experiencing stress. So of note, majority of the providers were caregivers, and they seem to suffer the most burden. And of course, many of you can probably relate to that even within the past few months. The women who are caregivers or who are on the front lines also have to go home and do the second shift, taking care of their family, cooking. Anyone who's also had to teach kids while they're out of school during this pandemic can understand that what a burden that must have been. Okay, so burnout was an epidemic amongst healthcare professionals prior to the pandemic. It was something that we were seeing a lot of, and there's been a lot of talk about that in the medical community of how to prevent burnout or how to recover from burnout. And even in 2018, this paper was published in the New England Journal to say to care is human and collectively confronting the clinician burnout crisis. Many of you may or may not know, but burnout is considered to be a very negative term in the medical field. That some people find that it reflects a weakness, as opposed to the reality that it's something that happens because we're human and we can only really tolerate so much. So there's some negativity around using the word burnout. There's also some negativity around the word resilient. Healthcare providers and military personnel are the most resilient people I know. And a lot of administrative things have been trying to push resiliency programs or burnout programs without actually looking at what's at the root cause of the resiliency. And it's often, of the burnout, and it's often the environment that we're working in. I'll step off my soapbox and get back to the presentation. So burnout is a syndrome characterized by emotional exhaustion, depersonalization, which is something I'm going to talk about today, numbing, negativity, inability to express empathy or grief. We're going to focus on that in this presentation. And as well, you get feelings of reduced personal accomplishment, loss of work fulfillment, and reduced effectiveness. So that ineffectiveness, not being able to provide or to help in the way that you had wanted to help when you started the profession, when we started the profession. Burnout was first coined and described in this way by Christine Masloch, Dr. Christine Masloch out of Berkeley. So let's talk about stress and burnout, and I'm just going to present the model of polyvagal theory here because it matches, as you know, oh so well with the gunas from yoga. Here we have the sattvic state, which is our window of tolerance. When we're stressed, we get that adrenaline charge that pushes us out of the window of tolerance into that hyper arousal or rajasic state where we're frenetic, we've got energy, we're charged. When we get overwhelmed in our stress state, so the whole idea is once we get that charge is we want to discharge that energy back into sattva. And we want to remember that that is a survival mechanism, that we go into hyperarousal, we go into stress as a good thing, as a way to survive and meet the challenge. But that we're supposed to, that challenge should be temporary and that we should be able to discharge that stress and come back to our baseline resting position before that next challenge happens. And that's the natural cycle of our stress cycle. That's what we want to happen. Unfortunately, what often happens is we get stressed, we go into that hyper aroused state, and we stay there. We get stuck in a prolonged stress state, which doesn't allow us to come back to that sattvic state. Now, if we find that prolonged stress state is overwhelming, we will fall down into hypoarousal, again, as a way to conserve energy. And that may mean numbing, that may mean not feeling, that may mean many things that fall under that the level of tamas in our yoga practices. So that heaviness, that inertia. So we're going to talk about this going up and down, and how do we get ourselves back into that sattvic zone, that window of tolerance zone. But before we do that, we need to take a couple steps back and understand a few things around empathy and compassion. So I talked about that depersonalization, starting to numb around that ability to feel empathy or grief or emotions in general. And that can happen when we go into empathic distress, which I will explain in a second. But first, we'll understand empathy, and we'll understand how it differs from compassion. Many of you have probably heard the term compassion fatigue, and we're actually changing that term to empathy fatigue. And there's two camps around this, because there's always people who fight. I would argue that compassion fatigue still exists, and it exists when we don't have compassion for ourselves, or when we're not able to generate compassion for ourselves. And we know that if we do not have, we cannot give. So we're going to talk a little bit about this and why it's so important to work with compassion, especially when you're working to heal your heroes. So empathy is our ability to resonate with the emotion of others. And what's really important to know about empathy is that when you're in that empathic state, you're still able to maintain your self-identity versus other. So you're connecting with the Purusha, and you're recognizing that you are not your thoughts, your feelings, your mind, all of that. That's where it really comes down to. You're still able to maintain your own autonomy, yourself experiencing the emotion of another. Compassion is the act. It's an act to relieve suffering. So when we resonate empathically with another person, we then will act to help relieve that suffering, and that's the compassionate act. We'll talk more about that as we go, and the importance of generating compassion. So empathy can be broken down, or it's on a continuum when we talk about emotions. And the first thing is emotional resonance, right? So that when we're empathizing with somebody else, we're feeling that emotion. And I have here a picture of a little girl. If you saw this little girl and she was sad, of course you would be like, oh, I want to go help that little girl. That poor little girl is sad. What can I do to help as an adult or as another person? That's emotional resonance. You're still maintaining your own sense of self as you're seeing this child suffer. But we can also get emotional contagion, and that's prelimbic or pre-verbal. So it happens before we're actually able to talk. If you've ever seen these two toddlers on YouTube having their little conversation back and forth, you can see how they resonate, how their emotions are catchy. And many of us have caught others' emotions when we're around people who are happy and we feel joy, when we're around people who are depressed and we feel depressed. We may even see it in children when we're having a family dinner and the adults are laughing, and then all of a sudden the children start laughing, even though they really don't understand what's going on, but they're laughing because everybody else is laughing. That's emotion contagion. And that contagious aspect of emotion is really important as we start to think of, well, what does that mean? It's great when we're laughing, but what does it mean when we're viewing or we're witnessing suffering? So what we know, and this comes from the research of Dr. Tanya Singer at the Max Planck Institute in Berlin, is that we do have an empathy for pain network, that when we witness the pain of others, we feel it as if it's our own. That can happen. So this is an interesting study where they took one group of people and they put them through the fMRI, and they started to pick them with pins. And they looked at where their brain was lighting up in the MRI to see where they were experiencing it. They videotaped that, and then they took another group and they put them through the fMRI as well. But instead of pricking them with pins, they made them watch the video of the first group. And what they noticed is the people who were watching the video of the other people getting picked with pins, their brain was lighting up in the same areas of pain as the first group. So we know we can experience other people's pain as if it's happening to ourselves. And that can be distressing. You can imagine if you're always witnessing or bearing witness to the pain of others, how that can be too much. And it can be too much. And that's when we go into what's called empathic distress, that what we're witnessing is too much, and then we start to shut down. Remember, that limbic system is saying we're overwhelmed. We start to go numb. We start to withdraw, and then we're less likely to provide that connective, that compassionate connective care. So that's a real thing. And what's interesting is that it doesn't have to be that, it doesn't have to stay that way. When they taught medical students, and this has also come from Singer and Klimecki, when they taught medical students to be more empathic, what they saw was they ended up getting more empathic distress. But what we also know is that compassion works on a different neural network than empathy. So when they then trained those medical students to practice compassion, when they were feeling that empathic distress, or when the distress was coming on, then they actually were able to soothe their distress, stay present, and stay within those boundaries of stay within that ability to provide empathic care. And so that's a huge skill to develop. And that's something that I really want to bring out in this talk, because if we can learn to practice compassion and teach compassion, we can really help reduce that empathic distress that comes on normally, because we're wired this way as caregivers, as humans. This is really important for us as helping professionals, because we do bear witness to suffering all day, every day. There's often some happy moments as well. It's not all bad, but it can be really distressing. And this is something that our healthcare professionals are really getting overwhelmed with in places where COVID has increased and has taken a toll on society and overwhelmed our hospital systems. So I just want to give you some terminology of how we classify these issues, or how we're talking about these issues in the healthcare professions. The first thing I want to talk about is secondary traumatic stress. So secondary traumatic stress is when you bear witness to another person's suffering. Remember, if you're not able to separate mind from body, or mind from yourself from your true self, from your mind, your thoughts, and what you're witnessing, you're going to absorb that pain as if it's happening to yourself. And that's called secondary traumatic stress. A buildup of secondary traumatic stress, or repeated secondary traumatic stress, is called vicarious traumatization. That you are traumatized simply by, or that I use the word you all the time, but I mean that as healthcare providers, as helping professionals, we get traumatized by witnessing this over and over. And many of you who are yoga therapists that work with PTSD, or work with anxiety, or work in shelters with the homeless, may start to develop a lot of that secondary traumatic stress and vicarious traumatization. Post-traumatic stress and occupational stress injury, that's when we ourselves experience a trauma at work and we're not able to process that memory. We get flashbacks around that. So again, a very real thing. It is not a weakness. It is how we are wired. When we are in those high states of adrenaline, and adrenaline is pumping through our bodies, it's very hard for us to process, or it impairs the processing of memory. And so the memory gets fragmented, and then we can get triggered later on. That's an important concept, and I'll get back to that in a minute as well. What I want to bring up, because this is something we're seeing a lot in our helping professionals on the front line during COVID, is moral distress and moral injury, mostly moral distress. Moral distress is a state where you know what you need to do, and you can do it, but you're prevented from doing it. That is distressing. And that causes a lot of hardship amongst us. Many of you have seen the sauna suits that everybody's wearing, the personal protective equipment. They can no longer smile at patients, or patients can't see their face because of the mask, because of the face shield. They can't touch people with their hands because of the gloves. They're themselves, in these hot suits all day. They can hardly breathe. They're sweating. It's a very difficult environment for them to work in. But what is most distressing is the fact that they can't connect empathically with their patients the way they used to. And this is what we're hearing them say. And as well, the sheer amount of people who are dying alone because we don't have personal protective equipment for their families to be with them. And most of us as helping professionals, you know, we've watched and witnessed death, but you know, it's always been, we can always call the family in. There's always been that humanity that has been able to happen that is right now being prevented because of the conditions under which we're working in COVID. And that's causing a lot of what we call moral distress. It's really important that we identify this and name it for the helping professionals so that they can validate that, yes, this is a thing, this is what I'm feeling, because then we can kind of start to work to heal that. Moral injury also comes from moral distress. It's when you feel, when the system is not backing you up. So then you actually feel injured by the system. You're hurt by that. So this is a paper that just came out yesterday, actually, from Dr. Canaris in the UK, talking about moral distress in the intensive care unit during the pandemic, the burden of dying alone. And this is what he writes. However, what kept us awake at night during the pandemic was moral distress. The thought that somehow we were complicit in allowing these patients to die alone, without their loved ones being able to say goodbye due to social distancing. Visiting restrictions, PPE shortages for non-clinical personnel, morphine and midazolam are poor substitutes for human familial touch. Moral distress goes hand in hand with insomnia. We work 14-hour shifts in a wearable sauna, went to bed, and were still unable to sleep. Instead, we lay awake staring at the flickering fluorescent white lights at our hospital accommodation, thinking about patients that did not get to say goodbye to their wives, husbands, children, or loved ones. There had to be a better way. You know, this is heartbreaking for me. I feel this empathically. I resonate with that emotionally. And to me, it's also distressing. If you watched the Lady Gaga world thing that they did for COVID with all the musicians and the Jimmys, if you listen to what the healthcare providers said, they all said, we want you to know your family is not dying alone. We're here for it. We are here for them. We are their family. This was considerable amount of distress for our helping professionals. But luckily in healthcare, there is a wave of compassion coming through. And when we are distressed, we also look for reason. Well, how can we act compassionately? There had to be a better way. And this took off on med Twitter as people were feeling this distress, that they started to bring in technology, using technology, phones, iPads, in the rooms with patients who are dying, having their families come in so they could connect with them and at least see them, even though they couldn't be with them in the hospital, they could at least see them virtually. They started a thing called the Connection Aid or the Connection Tool. I can't remember it, but I'll give you the link. And so when a person was admitted, they would have all these things written down. Who's their family? What are their contacts? What do they value? What's important to them? So they had those things with them so that they could connect and try to offer the care as best they can. And that's really powerful. That spread like wildfire on med Twitter, that this is what we're doing. Everybody do it. And people started to do it in places where they had the resources, of course. Of course, there's many places in the world where they don't have these types of resources, but hopefully this is the act of compassion that's coming through. But I want to recall this. For someone to develop genuine compassion towards others, first they must have a basis upon which to cultivate compassion. And that's that basis is the ability to connect to one's own feelings and to care for one's own welfare. Caring for others requires caring for oneself. And this is really important because most of us in the medical profession will put other people's lives ahead of our own. We're trained to do that. Self-care is beaten out of us. You know, like there's no time. You can't go to the bathroom. You can't eat when you need to. You must serve. And we do that. And that's where compassion fatigue can start to come in, because when things go wrong, as they often do, you know, you'll hear me mention the word code. When we run a code, that's a cardiac resuscitation. In the past, everybody could go, everybody had people on the code team had a role, they would play it. Now with COVID, even how a code is run has changed to reduce spread of infection. And that means only certain people can be there doing things. There's people on the outside directing or leading the code or helping from the outside, but they can't get in there and to do the work. And again, that's distressing. But one thing that happens to a lot of us who provide care to others is that when things don't go right, and they often don't go right, if you watch TV, 95% of the people they resuscitate come back to life. In real life, it's 5% of the people that get resuscitated come back to life. 95% don't, and that's really hard. And often, what happens for us is that we replay the scenario in our mind. What could I've done? Oh, I should have done this. I could have done that. Shoulda, woulda, coulda. We start shitting on ourselves. We're mean to our internal critic comes up. And when that happens in the brain, right, when we're starting to beat up on ourselves, the limbic system where our amygdala is sitting, our stress response, it doesn't know that it's coming from the inside. It just knows, is this a good time or is this a bad time? And if it's our mind, our ego turning around and beating us up, that's still going to trigger the stress response. And that's going to increase stress in the body. And that's where we actually want to work with our helping professionals to stop that internal critic, to change that samskara, to change that pattern, and develop the practice of self-compassion, of actually being kind to ourselves and compassionate, which doesn't mean being nice and eating all the cookies. It means being kind, that, you know what, this was really hard, and I did the best I could. So the questions I asked you at the beginning: how do you wish to be treated? How do you treat others? How do you treat yourself? What does your inner critic say? What's its tone of voice? Can you be mindful of that? Can you be aware of that? Because once we can start to notice that, that's when we can start to make the change, right? That's the self-reflection. That's Svadhyaya. What is my voice? What is this voice saying to me? And then we take tapas to start to practice the opposite. And this is where self-compassion as a practice can come up. Self-compassion was a practice coined by Kristin Neff and researched by Kristin Neff, and you can find out more from selfcompassion.org. It has 3 components, and the first one is mindfulness. Why mindfulness? Because everybody thinks mindfulness is the cure for everything? No. Mindfulness, again, is that ability to see self from other, to reconnect with yourself and notice that your thoughts, your feelings is separate from your internal self, your purusha, what we in yoga call the purusha. So being able to build mindfulness, what am I feeling in my body? Naming what's here, feeling that emotion, naming the emotion. When we name the emotion, we claim it, we own it. The amygdala actually reduces its signal to the stress response because it's the fire alarm going off, and it's like, oh, okay, you know the body is stressed, you know there's tension in my shoulders, you know what this feeling is. Sometimes we don't know the name of the feeling, but if we can be mindful of it, we can hold space for it. The second part is self-kindness. Can we then change that internal critic that's saying shoulda, woulda, coulda to this is really hard right now? Validating and acknowledging the experience. It's really hard. It's very hard. It's frustrating to watch somebody suffering and not be able to help the way I wish I could. And the third piece is common humanity. It's recognizing we're not alone in this suffering. When we realize we're not alone, there's a comfort to that. And right now, I think healthcare professionals are bonded in that common humanity they have amongst each other because they know what they're going through. And they know that this is different. And self-compassion can be very hard for people to practice for themselves. And Kristin Neff also says, ask yourself, how do you treat a friend? Can you talk to yourself the way you would talk to your friends? Especially with healthcare professionals, they know how to be compassionate. I mean, look at these people here. They know how distressing it is to not be able to smile at their patients or hug or touch them. And so, this campaign went around to put your smiling face on your badge so that even though your patient couldn't see you smile, they knew what you looked like. They could see that you were a human, and they could connect in that human type of way, that humanity that we all have, share that humanity. So the practice of self-compassion is so important. If you go to my website, I have a self-compassion break there. If you go to selfcompassion.org, Dr. Kristin Neff has it there. And the Center for MSC.org, Center spelt the American way, CENTER. If you go there, there's also meditations where you can download and listen to the self-compassion break. Another thing that is really important is the ability to ground. And I can't remember if I said this about self-care. We're all talking about self-care, that everybody needs self-care. What I want to really reiterate, self-care happens off the job. So, you know, as you heard, as I read the doctor's note, you know, we were on our feet for 14 hours and then we go home and we lie down. After 14 hours of being on your feet, it's really hard to do anything other than put your feet up, pour yourself a glass of wine and eat chips. So that's what most of us are doing. And that's just the way we numb. And, you know, maybe it's something else. It may be that you go to sex or what have you. But we fall to those things that are easy and soothing. And that's just what happens. So what's important to know is that although self-care happens off the job and we can start to incorporate it, self-compassion is a technique that you can apply on the job. So that self-care, that mindfulness, self-kindness, common humanity, all things you can do on the job. Placing your hand to your heart, reconnecting with yourself, safe havening, giving yourself a hug, and just feeling your hand, feeling our hands rub ourselves here, just a soothing touch can be really helpful for our nervous system to help mitigate the stress that we're experiencing in our day-to-day, to help kind of bring us out of that hyper-aroused state, closer to that window of tolerance, that sattvic state. So grounding is another way to help us come out of that hyper-aroused state and back to the present moment. We just practiced the beginning, a practice called Soles of Your Feet, where you invite people to inhale in, feel the soles of their feet on the ground in the moment. You can do a quick body scan with that as well to notice what's happening around me in the moment. What is here for me? Can I name it? And then I often encourage people to use compassionate breathing and inhaling in a nourishing breath to themselves, visualizing the breath coming in, carrying in something that they need. Now, realistically, breathing is a hard thing to do behind those masks. The N95s in particular, the breathing can become, it's hard because, you know, you feel like you're breathing recycled air, but really trying to use your in-breath to draw in nourishment, light, energy, courage, strength, whatever it is you need as your sankalpa, as your resolve to carry that in on the in-breath can be really helpful. Exhaling, we all know, can help reset that nervous system. So as we exhale from the root out in a prolonged exhale, so that we're not hyperventilating, that we can also chant a mantra on that, right? Not me, not mine. Namo, namo, namaha is what we say in Sanskrit. I'll invite people to say whatever they need to say to let it go, to release. When they're ready, inhaling in a nourishing breath for themselves, exhaling out, releasing. And then they can go into the practice of compassionate breathing, where we breathe in a nourishing breath for ourselves and we breathe out a compassionate breath for others. That is based on the Buddhist practice of Tonglen. Many of you may know that practice where you breathe in the other person's suffering and you breathe out compassion. That can be really hard when you're already in empathic distress or you're already numbing from the suffering around you. And so the tweak to that is fill your cup. Inhale, breathe in compassion for yourself. Allow it to fill your body. Exhale out compassion for the other. And then you start to create this cycle, this breath of compassion, which is really powerful because if it helps you stay present, for one thing, it helps you stay in the midst of recognizing that suffering is here. May we be free from the suffering. But remember at the beginning when we talked about empathy and we talked about emotions and emotional resonance and emotion contagion. And what's so beautiful about the practice of compassion is as you start to breathe in compassion for yourself and soothe your own suffering, you generate compassion within, you reduce your own empathic distress. And maybe if you only stay at that stage, if you don't get to the place where you're breathing compassion out, it's still okay because the other person is going to be resonating emotionally with you and will sense that compassion. So you'll still have that compassionate connection. So that's why it's such an important practice, especially for us as yoga therapists, to practice ourselves with our own patients and clients and teach, right? We have to do it in order to demonstrate it and to lead the way. So another concept I really want to bring light to, especially for those of you who are working with people who may have never meditated before, is this concept of backdraft. So when we're up in that hyper-aroused state and adrenaline is flooding our brain, the memories don't get to process, and so they remain fragmented. But as we start to come down into a place of safety where our nervous system is being regulated, those memories start to rise up again in order to attempt to process. And that's what Chris Germer calls backdraft. Dr. Chris Germer is one of the authors on the Mindful Self-Compassion program. He's also a yogi and has a very strong compassion practice. He calls this term backdraft. And if you remember the firefighting term or the movie, backdraft is, so let's say there's a room and it's being, fire needs oxygen to survive. So when a room is deprived of that, or when the fire is deprived of oxygen, it can't burn. So if you remember the term from firefighting, is they would feel the door. And when you went to open that door, when the oxygen goes in, it gives fuel to the fire, and up comes this backdraft. Now, how I usually explain this to the people I work with is that, we don't want to have too much suffering when we're meditating. If backdraft is coming up and it's uncomfortable, come out of the meditation, go back to the grounding practices, see if you can practice compassion to help self-soothe. And if not, just feel yourself on the ground, name 5 colors, do the other things that you may do to ground yourself in this moment, and let go of that. However, recognizing that eventually we have to kind of process those memories. And as our compassion practice becomes stronger, that may be easier for us to do. We wouldn't want our firefighters to put out all the fires except for, and then come out and say, oh, the bedroom on the left, or the 3rd bedroom, that one, don't open the door. We think there's a fire in there. You wouldn't be safe living in that house where that door was still closed. So eventually we do want to, eventually this will come up, but hopefully it will come up in a way that we've enabled people to do so, to respond to themselves with compassion when that happens. So very important to teach people about this phenomenon that comes up in meditation, and to label it so that they know how to respond to it with compassion to help themselves and not get overwhelmed when they're meditating. So for me, it's always, for when I'm working with a frontline healthcare professional, it's always start where they are. If they're very anxious, you want to release the tension in the body with a practice to bring them out of hyperarousal. If they're very fatigued and numb, I usually give progressive muscle relaxation because we know it works very well for insomnia. I start bottom down, toes up, tensing and releasing, coordinated with the breath. That's on my website. If you want to listen to a PMR practice, a progressive muscle relaxation practice, there is one there. You can also Google that and put it on YouTube, and you'll get many. Exhale focus pranayama, because of the ability to, we know when we exhale, right? We release our stress. We come back to that place where our body can start to come back to that sattvic zone again. So that window of tolerance. So exhaling to re-regulate the nervous system. Again, you can use a mantra, not me, not mine, namo namaha, if that's what they relate with. And then the self-compassion break. So when difficulty comes up, being aware of that, the suffering is here, connecting with themselves. May I know this too shall pass. May I be free from the suffering. May I know that I am not alone in experiencing this. This is what connects me with everyone else. We all suffer. And although my suffering may be different than others, it is nonetheless suffering. As well, I teach a meditation called Giving and Receiving Compassion with phrases of equanimity. That is, again, from the Mindful Self-Compassion program. You can also find that one on my website. And that just involves compassionate breathing. Inhaling in for yourself, energy, a nourishing breath, compassion, exhaling out compassion for the other. We practice that a little bit at the beginning. Insomnia, what we know can help with insomnia is progressive muscle relaxation or restorative yoga, slow meditative exhale focused movement. Yoga Nidra has been very helpful. I-Rest Yoga Nidra has been studied in our military population, also beneficial in our helping professionals in our front line. I believe Dr. Richard Miller has given a talk for Global Yoga Therapy Day on that topic. Meditation as well, being aware of backdraft, and as well, just to, so you know, these practices upregulate GABA and NAM in the brain, which is which fills in our GABA receptors, which actually turn off the excitatory. It's like Valium. It's like natural Valium for the brain. Also induces alpha waves. So that's great. One thing we want to be sure of right now, everybody's kind of working toward this common goal. So this common humanity is existing. After the pandemic, when people actually come out of this prolonged stress state, this prolonged state of hyperarousal, that's where we may start to see more of the problems arising within, more of the burnout, more of the distress arising within our healthcare professionals or helping professionals. And this is really when we may start to see grief come up and the need to mourn that. And that's really important, that we hold space for them and we recognize, even though that the pandemic is over, that after the fact is really when they start to process a lot of this stuff. And we really want to be there for them as they're going through this as yoga therapists. I always quote Mr. Rogers when I talk about this. People have said, don't cry to other people for years and years. And all it has ever meant is, I'm too uncomfortable when you show your feelings, don't cry. I'd rather have them say, go ahead and cry. I'm here to be there with you. And we can be there with them. We can be there for ourselves when we practice that compassion. When we practice compassion for ourselves, we can hold space for others. And it's a beautiful thing, and I hope we can all do this so that we can really be there for these people for our frontline heroes who are doing so much right now for everybody else. So ending with the Dalai Lama, if you want others to be happy, practice compassion. If you want to be happy, practice compassion. Thank you so much. I hope it wasn't too much. You can find all the meditations that I've talked about on my website, just on the front page. They're free, theyogamd.ca. If you want to find out about my offerings and other tidbits that I send out, my newsletters, which I send out for helping professionals, please sign up for them. I do have a program called the Yoga of Stress Resilience, Arising the Yoga of Stress Resilience, which I currently offer through the healthcare system here. I'm going to be putting that up online in the fall, so watch out for that. For more information on Mindful Self-Compassion Program, visit centerformsc.org, and you can find out their practices there. You can follow me on Twitter at Shalavedya and at the Yoga MD. I'm also on Facebook under the Yoga MD, on Insta, the Yoga.MD, and I have some of these practices up on YouTube at the Yoga MD. So thank you very much for paying attention, for attending the talk, or for listening. I hope it's helpful. And if you have any questions, please connect with me. Thanks.